Good morning. I am Dr. Soumitra Kumar, consultant obstetrician and gynecologist at Rowden Street, Bhagirathi Neotia Hospital. So today my topics will be anemia in pregnancy. So anemia in pregnancy is quite common in our country and especially in West Bengal. And NFHS study shows that the last years in 23 it was 52% incidence. And the iron deficiency anemia is the most common one, and there are several other things, that is vitamin B12 deficiency anemia and folate deficiency anemia. But iron deficiency anemia is very important because intake, malnutrition, and without proper idea that which foods we got to have during pregnancy is important. And what is the effect? It affects the baby also. The baby's growth will be jeopardized, and the preterm delivery and low birth weight is a problem. Then the mother will get the symptoms and signs, especially they will get fatigue, weakness, dizziness or lightheadedness, headache. They become pale, shortness of breath and postpartum depression. These are the common things that we get during in anemia in pregnancy. Now we will think about the amount of hemoglobin, which will say that this is anemia in pregnancy. There are severe anemia in pregnancy, moderate anemia in pregnancy, and mild anemia in pregnancy. So if it goes below 10, we call it mild, and between 7 to 10, then moderate, and then below 7, we call it severe anemia in pregnancy. So the treatment, there are three things we must remember. The one, we got to give good food, especially the nuts, cereals, green leafy vegetables, iron fortified breads and dry fruits, legumes and vegetables. These things are very important. And another thing we must remember, that the tablets forms of iron that we can give, and if it fails, then we can give injectables iron. Injectables iron, which we call it FCM, that is ferrous carboxymaltose injections. Before giving ferrous carboxymaltose, that is injectable forms of iron, we got to check total iron binding capacity, serum iron and serum ferritin, because that is very important. If the iron stored is low, it helps a lot. But if this thing is high, especially in some of the diseases, that is thalassemia, then obviously iron you shouldn't use. So you got to use it judiciously. Now the requirement of iron in pregnancy is 27 milligram per day. So the tablet form, there are succinate form of iron, there is ferrous fumarate, and there is ferrous ascorbate. So different type of salts are there, and the absorption is very important. Some of the patients, they complain that after taking they get nausea, vomiting and constipation. So in those patients, we got to think of injectable iron obviously. And in some of the patients, when we will be seeing that the blood hemoglobin level is less than 7, we got to think of blood transfusion and iron supplementations. The thing is that during pregnancy, what happens, the mid-trimester, that is 28 week, the hemodilution takes place, and that is the reason why the anemia is anemia takes place in pregnancy. That is why from the very beginning, at the onset of pregnancy, we give iron supplementations. And in some of the patients, we get some of the medical disorders associated with pregnancy. Suppose a patient gets anemia with fever and some lymph nodes, obviously one should think of leukemia, Hodgkin's lymphoma, non-Hodgkin's lymphoma, and plastic anemia is also very important. So, and another thing is that piles. Some of the patients complain of piles, and they have the bleeding per with stool, and in those patients you can get anemia in pregnancy, and we got to think of it. So this is as a whole the management of anemia in pregnancy. Thank you.